Managing the side effects of cancer treatment is very important to helping you feel as well as you can and avoid interruptions to your treatment plan. Let's talk about how you can eat to fight the side effects of cancer treatment. Choose soft, bland foods. Softer foods will be easier to chew and swallow. Now, this doesn't mean choose foods with no taste. Just listen to your body and choose foods that are easy for you to swallow. Soups and stews are good options as long as the meats are soft and tender. For breakfast, try having foods like instant oatmeal, grits, pancakes, waffles, and cold cereal that has been softened with milk. Pick side dishes like cottage or ricotta cheese, macaroni and cheese, mashed white or sweet potatoes, and rice or risotto. For desserts, try custard, tapioca pudding, ice cream, milkshakes, or sherbets. Prepare foods in ways that make them easier to eat. Whether you're at home or somewhere else, there are different things you can do to ease the pain of eating. Cut your foods into small pieces. You may even consider using a blender or food processor to puree your foods. If you're cooking your own foods, cook foods until they are soft and tender, especially vegetables and meats. Preparing softer foods can be easy. Try this berry parfait. The recipe is on mypearlpoint.org. Add in some liquids when you're eating. Serve your foods with gravy, broths, or sauces. Try having your favorite sauces with your cut-up chicken or beef. Choose soft or canned fruits or applesauce instead of raw fruit with tough skins. If you do want to use fresh fruits, you may want to try a smoothie. Put your fresh fruits in a blender along with some Greek yogurt and orange juice. This provides the perfect snack with some added protein. Most of all, listen to your body. When there are foods that you notice that make your mouth, throat, and tongue sore, try staying away from those foods. Common foods that make mouth sores worse include citrus fruits and juices, salty or spicy foods, acidic foods like tomatoes, carbonated or caffeinated drinks, and beer, wine, liquor, or any other type of alcohol. Avoid very hot foods. Hot foods can cause mouth and throat discomfort. Choosing foods at room temperature or colder can help to soothe the mouth and throat. Allow soups or other hot foods to cool to room temperature before you eat them. Try freezing fruits and suck on frozen fruit pops, fruit ices, or ice chips. Choose foods that are a good source of protein. This will help to keep you energized and ready for treatment. This will also help prevent any weight loss. You can make sure to do this by having a good source of protein with each meal and snack. Since 5 to 6 small frequent meals are advised, this would mean you're getting 5 to 6 good protein sources in a day. Try to choose protein sources that are also soft, as we've talked about. Some examples could be ground meats, eggs, cottage cheese, yogurt, custard, beans, lentils, or smoothies. See our video, Loss of Appetite, to get more suggestions for getting in frequent meals and protein. Drink at least 8 to 10 8-ounce glasses of water each day. This is 64 to 80 ounces of water total. To put it in perspective, one 2-liter soda bottle is 64 ounces. If you have a hard time keeping track with how much you have had to drink, try keeping an empty 2-liter soda bottle by the sink. Every time you drink a glass of water, put the same amount into your 2-liter soda bottle. This will help you to keep track of how much water you have had and how much more you should drink. Drinking liquids with your meals can make things easier to swallow. You may also try drinking through a straw, as this can help push the foods past the painful sores in your mouth. Try sipping cool drinks between your meals, making sure to avoid caffeinated and/or carbonated beverages and alcohol. Lastly, make sure to use good mouth care. Rinse your mouth several times a day. You can mix 1 quart of water and 1 tablespoon of baking soda to make a rinse that will remove food and promote healing. Just a couple of other simple tips for good mouth care. Use a toothbrush with soft bristles. Remove dentures, except during eating, if your gums are sore, and make sure to keep your dentures clean. And lastly, avoid cigarettes, cigars, and tobacco products altogether. Be sure to speak with your doctor or healthcare team about any side effects, especially if your gums are bleeding or if you have white patches in your mouth. Both of these can be signs of infection. Your doctor may also be able to provide you with a special mouthwash or spray that can numb the mouth and throat. Remember, be patient with yourself, as side effects of treatment are usually temporary. Overall, just try to make good nutrition a priority, knowing that you can eat to fight cancer side effects. And we thank you from Pearl Point. Visit My Pearl Point and set up your profile to get nutrition tips and more. It's quick, easy, and free. Our side effects management app is also available from My Pearl Point, so you can have our suggestions on the go.